Dr. Joe Sirven, welcome to the 2025 Strategic School Staffing Summit. We are so happy to have you here today. You're known for your work in neurology and health equity and as a thought leader in health systems. And we're so happy to have you bring this unique perspective to our summit this year.
Carole, the honor is all mine. I'm really excited for our conversation today.
So, Joe, I have to start this conversation by telling you a story. And this is like years and years ago. I was at Mayo. We had just been starting to think about what does it look like to think about the educator workforce and how do we broaden it and how could, people work on teams and how do we get out of this one teacher, one classroom model. And I'm in the emergency room at Mayo, but on the wall is this poster that says, "Who's in your room?" And it's these little squares and people like with different colored scrubs. This, poster. And I'm saying to my husband, take a picture of this poster because this is what we need in education. This is kind of where it started. So I feel like, this is like the perfect way to start a conversation is with somebody that comes out of a system that has been thinking about, a workforce and who's in the workforce and how do they work together and how do they serve, right, the people that they serve in a better way. Just start with your own sort of personal journey from that and just, what about school or perhaps not about school really inspired you to pursue medicine and which been your experience sort of leading teams in healthcare, those kinds of things. Just give us a sense of who you are.
I'm first generation Cuban, first one born in the United States, but my family were all from Cuba. So they immigrated from Cuba. They all spoke Spanish, but since I was growing up in Louisiana, me and my brothers, as we were in school, we spoke English. And so what started the journey was basically my grandmother got sick and I was, I think somewhere around 11 or 12 years of age, and she had to be admitted to the hospital. And I ended up being her translator, an 11-year-old translator, which in retrospect, I'm like, what were we thinking? I remember this 1 week in the hospital as a grade schooler next to my grandmother as a translator. And that was started the whole thing. As I remember riding the elevators. I remember walking these hallways of that time. And that started the journey that I was going to pursue medicine. I remember this all the way from the 6th, 7th grade, junior high. So that's kind of been my journey. I've been with Mayo Clinic, my goodness, more than 25 years, led education for them at Mayo Clinic in Arizona. Currently, and I served as department chair in the Department of Neurology for them. I'm a neurologist by trade. And in my education role now, is I serve as the lead of education activity for the American Academy of Neurology, which is all neurologists across the U.S. In terms of what curriculums and things should we be learning to always keep our current neurology workforce in the United States that touches many of you, I suspect, to be always up to date. And what's the best way to train? What's the pipeline? What's the exit? What's graduation look like? All the way to the point that they may retire.
Talk about this idea of teams in healthcare. How do you train for that? And what's this sort of, can you share a moment of your own sort of thinking around how you work as a team and collaboration?
I'm married to a nurse. My mother-in-law was a nurse. And so I learned very early in my career that it is not about just being a doctor. And I learned very quickly that relationship, that team, that's like one of the foundational pieces of the relationship is everything because we each have a different role to take. And I learned this particularly in med school and in residency that I learned just as much from my mentors and my physician folks as I learned from the nurses that were on the floor, the clinic, because what I always knew is that I did not have all the answers. And half the time they would bail me out if I was making a wrong assumption or something in that direction. And I learned very quickly that trust, that relationship gets us all to a better place for the betterment of the patient. when I joined Mayo 25 years ago, Mayo really blew that aspect up to a level that I felt like I'd finally come home in terms of this is the way I want to be able to practice, which is amongst a team and isn't just doctor and nurse, although that is, as I said, a foundational, but of everybody, all the other professionals that really have emerged as healthcare has gotten incredibly complicated with just trying to keep up with all the knowledge base. Not one group is the owner of everything, of all the knowledge, if you will.
Yeah, it's interesting. I mean, we talk about this as like a system of care, right? I hear in healthcare people talk about that at all. We're building systems of care, right? It's not just a doctor patient or a nurse patient, right? This is a whole system. And I'm wondering, from your education lens, like how do you build that sort of ethos into education to get people to start saying, look, I can't do this all by myself. A teacher cannot in a classroom anymore really do everything, be everything to everyone all the time, as we say.
But I think that the easiest answer came in the sense of understanding that we all have a shared vision and mission. So I'll give you my easy answer. I'll give you kind of like from a Mayo thing. One of the things that greets me the moment I log onto my computer, every sign, everything is that there's a sign that puts out one central statement, which is the needs of the patient come first. It's everywhere. It's a core mission. Hallelujah. It's a core element. When you start on that, if just on that basis, you start kind of saying, well, I certainly can do a lot in terms of guide care, but I don't know every nuance of pharmacology. I don't know how the healthcare insurance is going to work. I don't know what the social piece of this that the person's not telling me. What's nice is that when you get people who are into this, I want to help this one patient. I understand that this is the mission. And you also are humble enough to know that you don't know it all. Teams kind of then forms naturally. And so one of the things that I love, for instance, one of the highlights that really kind of points this out is that every Friday morning, I'm one of the areas I do is an area in epilepsy, so a subspecialist. We gather together the neurosurgeon, the neurologist, the radiologist, the neuropsychologist, a pharmacist, a social worker, and nursing and technicians that do the EEG. To all, we have a patient, their name comes up, we present the story, and we're saying, can we or can we not do surgery or not do surgery? And then everyone contributes their piece. What did the film show? What did the technical thing show? What did the psychology show? That's all a learning piece. So I'm always picking something up from what these other professionals are telling me in areas or not. And so it's assembled as a team. And so to get to that team, we all understand, each of us, that we don't have all these answers because we have 7 other specialties or professionals sitting right there at the room that have other pieces of the answer. And it's just a matter of convening it together. So I think it all starts with kind of like a humility of like, I don't have all the answers.
I love that.
And other people may have that. And then the pragmatic piece is like, because I don't have all the answers, I need to talk to them, and I need to talk to them. That's how it kind of starts, if you will, is just understanding that piece, and that we're all in a shared mission of like that patient that is on the board at that time. That's what we are trying to do our best by.
This also does come with challenges, right, at times. And I'm wondering how you navigate those, and what are the kinds of challenges that, coming together in teams, what also do you face, and how do you prepare for that?
As any type of human team will have, there's always going to have a difference of opinion. Number one, you have to have a shared culture of safety to point out that it is okay to disagree, not for the sake of listening yourself talk to show that you're smarter than the other person, but you have a point and you disagree on some element, and you're not going to get harmed for disagreeing. That culture is tops. Number two is that you are going to listen to what everyone says. So everyone has to be given that opportunity, not one person hogging it. And even after all of that, that who has the final call? Ultimately, the way we do it is that, okay, so-and-so is going to present this to the patient, and the patient gets to make the call once we give them that information. So that's a part of the model of what we call shared decision making, which is supposed to be the tenet of medicine in our current times. But understanding that this gets up to the final say. So just know that that's the reality, that it will funnel up to one person if it needs to, but the patient will make the decision ultimately.
This comment about, people having to have humility is so on target right now, for just so many reasons, that I really, really appreciate that and appreciate that sentiment. I'm wondering how you start to, prepare people, right, to work in these kinds of environments and with that kind of mindset. Because people don't always come in with that mindset. Now that you're in the midst of all of, medical education and thinking about preparing people for this, and how do you get them to shift when it's not just naturally there?
The first element is the pragmatic piece of it, is just understanding that we don't have all the answers and we need help. Currently, in the world of not only neurology, but in all of medicine, there is a sudden influx of not just folks like myself, other neurologists, or other physicians, but there's nurse practitioners and physician assistants, and they are very much increasing in the ranks. We work alongside them, side by side. And, one of the things that occurs is that we have to understand where they're coming from, where are they, what's the culture of each group. So it's that, number one, the shared mission and mission of reminding people what we're doing and who we're taking care of first. The second piece is a lot of learning to occur together. So it used to be that if I went to a medical conference with just other physicians, now it's the physicians go. There's pricing for nurses. There's pricing for these nurse practitioners or physician assistants. And those elements of putting us all together in the room starts to kind of deliver the signal that this is all team-based. I'd also say then there's also need suddenly for communication-based classes or reading materials so that we are all able to communicate in a way that's respectful, and understanding one another and understanding where we're all coming from.
That's really smart. I mean, in education, we see, the teachers have their conferences and the counselors have their conferences and the social workers have their conferences, but we rarely do we all come together, right? And really think about, how we're working together and what are the issues we're facing and how do we think about that together? So it's interesting to think about as well. Mayo has been a leader, right, in patient-centered care now for decades. But what do you do, right, when this sort of patient-centered model bumps up against broader healthcare systems designed for more normative approaches? Because, we're facing that in education. It's a tough hill to climb.
What I will say, in terms of just Mayo approach versus when it bumps up other realities, is that the secret sauce, at least what I've always believed at Mayo, is the fact that how you hire and bring people on to understand what the mission and goals are. We tend to try to avoid folks that don't work well together, to be honest with you. In order to be able to be in a patient-centric environment, who you bring in really is huge, that they're buying into that approach. Not the ego and I am king and I am going to, what I say goes, but more about I want to be working with another group of professionals for the improvement, in my case, of the patient, and in an educator's case, and for the betterment of the student. And we're all buying into this. And I don't know everything, but I'm going to do my best to work with this wonderful group and learn together. Ultimately, I think it works because, again, everyone is buying into that. And that's why I've always believed that the secret sauce to Mayo hasn't always been the physicians, because I can find a bunch of wonderful other physicians that aren't in the Mayo system as well. But it's the folks that are around, that surround the team that surrounds that doctor or that nurse. And that starts from literally all the way from the person who is serving in the cafeteria to the chaplains to the maintenance, that there's a certain professionalism and respect and an understanding of what we are all there for. And I think they've done that very well.
I have that same sense at ASU, right? Like, you're not here unless you really want to be here, and you really want to be part of something that is really different. And I think that's what I'm hearing from you around this Mayo system too. So I can relate to that just in terms of our own context here at ASU. And I know you're sort of part of us as well. So, you understand that too. I wonder, what, just historically, what have been some of the systemic barriers that have prevented sort of broader adoption of patient-centered, team-based care models like Mayo?
And they are still the same problems that exist in 2025 and all the years before. Most of it has to do with the fact that we have a very fragmented health system where there is a lot of different players, a lot of money that people will kind of go in there, and sometimes people are in it for that purpose, and that has been a problem. So when you are not patient centered, and if it's for profit or something along those lines, it can be your goals may not always be aligned with that, and so I think that that's one of the barriers. I'm not saying that you have to not be able to earn a living or something along those lines, but just understanding that that piece of it can be problematic between for-profit or not for-profit, and how does that work? So that's one element. One other piece that I've liked about the Mayo system is that the records, it's a multi-group situation. So they have the radiologists, they have the surgeons, they have the primary care, they've got, from soup to nuts. And so everyone is on one medical record system, and they can see what the other person is writing about a patient versus I've got 7 appointments, 7 doctors, and no one has seen the note from the other person. That integration into team-based approach, there's primary care, specialty care, is huge in terms of making sure that the system works for the betterment of the patient. And I don't think and a lot of practice out there are not that way. You can go, one system may have your cardiologist, another system may have your internist. Those records may or may not talk to each other, which only blinds the other person to what's going on. Those are the real challenges that we really face in terms of just as just trying to care if someone is just making sure that there's not a piece of information that is outside of our systems that no one is seeing.
Clearly, education systems in terms of data systems and reporting systems and all that are messy, right? Because, schools typically don't share information. Teachers aren't sharing. There isn't that one record, right, about a kid. We face the same kinds of problems. I'm hopeful, right, that new technology systems can help us to solve some of those issues as well. There is this sort of paradigmatic image, right, of the trustworthy physician, right, which is often the individual doctor, right? He's known me since I was a kid, right? Similarly with teachers, where people will say to me, oh my gosh, but if we move to teams, who's that one person, right, that's going to know all these kids, with the belief that actually, all those relationships are can be made, or that one person is going to have a relationship with all of those kids. And in fact, it probably doesn't happen that way. And I wonder, how we can translate that sort of same depth of relationship, trust, transformative impact, right, to team-based models. Like, how do we ensure that those sort of relationships are also important in this, and that we think about the balance of that as we move to these kinds of models and systems?
Yeah, those relationships are key. And I guess the way I would kind of frame that is say, although I have been working as part of a team for literally my entire medical career, there's always going to be a person that the patient sees. So in this case, that's me, just for follow up to check in on them. And then these other specialists, they may just see when they need them, like the surgeon or the anesthesiologist. Mm-hmm. Nonetheless, because you have that one person, you still have to have, even in a team-based model, you still have to have that one person that is going to be the follow-up, the primary care, that principal person that they're going to establish the relationship with. And to be honest with you, that's still an element that has to be maintained even as you're kind of managing with students, someone that they connect with in that direction. Having said that, I know that surgeons will all connect and other doctors will also connect in their moment when they have to touch the patient. But know this, that you still have to have that one person that maintains that relationship, because otherwise the whole thing won't work. So as long as you have someone, whoever you assign in the team, that's going to be kind of responsible, if just for those check-ins, that's where the relationships form. And relationships are still going to form with the others as well, because you're meeting people, just like in education, at a very vulnerable time in growth and where you are in your life. And so those formative things, those relationships still do very much occur.
We're going to wrap up here. And this summit, convenes educators and leaders working in K-12 and research and policy and government, advocacy, nonprofit, ed tech, business. We're running the gamut here in terms of now who's coming to this summit. And I'm wondering, what advice would you give to education leaders about creating systems that support teams and individuals to work more effectively together? Especially in a mission-driven context, like education, or in your case, medicine.
Yeah, and I think, Carole, it starts right there. First of all, make sure that my best advice is make sure that everyone understands clearly what that shared mission is. As I said, I know by heart the needs of the patient come first, which is what is told to me every day, the moment I log onto my computer to when I exit. But I also know that everyone I work with is in that shared world. Understand that you have to have a culture of trust to listen to one another, and you just can't give that lip service. You just have to know that people are going to be bringing in their own areas of expertise. Humility, understand that you can't know it all, and that as a result, you have to have a team to do this in the shared driven model. And you kind of have to understand who's at the top to make the final decisions, with the ultimate source of what you're doing this around. The student or the patient is really going to make the ultimate decision, but who's going to present that information to them? Make sure you give them resources to do their job. Don't tie their hands behind their back, if you will. And also understand that this is an endless cycle of lifelong learning. It's continuous improvement. It's not going to be the same in 2025 as it is in 2030 and onward, because there's going to be new things that we can implement. But if you have that culture of that shared mission, that team, that humility, and everyone understands their roles, you'd be surprised what you can accomplish.
Wow. Okay. I can't wrap it up any better than that. Humility, trust, principled decision-making, culture, all those things. What a fabulous interview. Thank you. Thank you so much. This has just contributed greatly to the work that we're trying to do. And hopefully everybody really appreciates and has learned some things today. Thank you so, so much.
Honor was mine. Thank you.